think we're going to get started. If people end up coming on, that's fine. So for those of you who don't know me, my name is Christina Hildebrand. I am the founder and president of A Voice for Choice Advocacy. We educate and advocate and empower people to know their health rights. We are based in California, and when I say health rights, that has to do with informed choice, informed consent, transparency, privacy, those types of things. We also want you to know what's in the composition and the quality of your products, and whether you choose to take those in, that's your choice, and that's sort of where we stand on most things. If it is a toxic substance, we do want to stop it being in the environment. So I'm going to start off with questions. Okay, and first question is, as the bill is written now, I'm going to assume this has to do with AB 659. The question is, as the bill is now written, will those students who have a grandfathered medical exemption still be required to take the HPV vaccine to stay in school? I have a high school sophomore daughter with a medical exemption. So the way the bill is written, so let's be very clear, we're at the very beginning of this process, and the bill has a long time until September to be signed by the governor, if it gets signed by the governor, but it has a lot of iterations that it can go through. So as it is written right now, it says that you must have the HPV vaccine to enter 8th grade. And the question there becomes, does that mean 8th graders from now on? And so it would only apply to 8th graders in the future, or does it mean that they will apply it to high schoolers? The way it's, sort of specifically written now, it makes it sound like it's only you can't pass 8th grade without having the HPV vaccine. So anyone in 9th grade or high school or 8th grade this year would be off the hook for it. But I say that hesitantly because you never know what's going to happen with the bill and whether they change that, whether they allow grandfathered medical exemptions, even if your medical exemption doesn't say that, HPV vaccine, those types of things. So it's hard to know, but as it's written currently, yes. If you have a 9th grader, 9th grader, or high schooler, 10th, 11th, 12th grader, they should not be required to get the HPV vaccine this year, next year, for whatever grade they go into. Okay. Next question. Will you be providing a written summary of the top key points to include in our opposition letter, and specifically who to contact, just in case there are others besides those who I'm aware of? So again, I assume you're talking about AB 659, the HPV mandate bill. So if you go to our website, avoiceforchoiceadvocacy.org, and then go to legislation or advocacy and drop down to 2023 legislation, and then go to this bill, on that page, there is all the information that you need. We have 3 resources. We have a summary flyer, we have talking points to go with that flyer, and we have our letter of opposition. And we also have an email that you can click on, or an email function that you can click on, and it sends your email directly to who it needs to be sent to. If you do that, or if you write a letter yourself, our request is, or our suggestion is, that you really make it your own words, because legislators read these emails, and once they start getting all the same email, they just stop reading them. So you do want to make it personalized, but there are talking points on that page. The other thing that you need to do, so there are 2 things right now that we're asking people to do. Number 1 is send that email. And number 2 is to upload your letter to the legislative portal. And number 3, if you haven't done so already, make sure you get a meeting with your assembly member. And many of those assembly members are having town halls and coffee mornings, that type of thing. And so sign up for your legislators, for both your senator and your assembly member, sign up for their newsletter on their website. And that way you'll get information on when they have town halls. And that's the best time to go talk to them, is when they're out and about in their community, because they want to hear from constituents. So definitely sign up for the newsletter and see if they have anything going on in the next week or 2. Okay, next question. Thanks, Christina. I find it really overwhelming to figure out what to say to legislators or anyone who would want to give a message about what is wrong with AB 659. It seems that really the reasons are many and complicated. How to make it simple but impactful. So we have a one-page flyer which has probably 5 or 6 different talking points on it. It covers discrimination. It covers that it's a STI, not a communicable disease. It covers that there's litigation. It covers that it's not necessarily safe and effective. What I would recommend to you is to find 1 or 2 points that resonate with you and that you can talk to, and just focus on those points. There is a lot of information. I mean, our letter of opposition is 4 pages long, and usually I put a dead stop at 2 pages because they never get to 4 pages. But on this one, there was just so much information that I did put it into 4 pages. I would recommend, as I said, just focusing on the issues that are near and dear to you out of those. I would also read your audience. So, for example, if it's somebody who thinks vaccines are fabulous, I wouldn't go into the safety and efficacy of the HPV vaccine. There is a lot of controversy over that, and there's a lot of data showing that it's a bad vaccine. But going into those weeds is hard when there's somebody who is so for the vaccine. And so usually with legislators, for example, I don't go into the science of vaccines because they just have their ears closed. They don't want to hear it. And it's much easier to talk to them, for example, about education. So only 30%, or sorry, only the 70% are vaccinated for HPV teens. And so therefore, there are 30% of teens who are not vaccinated. That's about 700,000 kids. Now, we just shut down school for, however many years in COVID. And do we really want to do that all over again to these children? And, some legislators will say, well, some of them will get vaccinated. Yeah, some of them will, but many of them won't. And what does that do to our school system? The financial losses, what does it do to the children, their mental health, those types of things. So there are certain things that, I focus on, especially if I'm talking to people who are very pro-vaccine, or I don't know how they stand on the vaccines. I approach it from a different way, where I know that they can resonate more with it than if I'm talking the science. Okay. Christina, are you going to go over any other bad bills tonight, including AB 659? So we are going to put out, by the end of this week, we are going to put out an email showing the bills that we are opposing and we're supporting this year. Our legislative director, Leah, amazing person, she has gone through the nearly 3,000 bills. I think we've got 2,600 this year. And just to clarify, that's 2,600 different pieces of legislation to change our laws in California. To me, that is just insane. If there was one change I would make, that would be it, to get rid of the amount of bills that we have coming forward every year. But we go through, Leah at this point goes through all of those pieces of legislation and sees which ones resonate with our mission statement. So we oppose and support bills that are specific to our mission statement. As a nonprofit, that we have to keep within those constraints. And right now, the only bill that we're opposing is AB 659. There are a couple of other bills that don't fall within our mission statement that I'm sure other organizations are going to be opposing, that have to do with transgender. There's one bill on mental health. So in California, you can get mental health treatment when you're 12 years old without your parents' consent. And that bill, I've looked at it, and it basically allows children to do it more easily. And we're looking into that as to how much it really expands that bill. We're not for 12-year-olds getting, consenting to anything, especially things like vaccines. We were against SB 866 last year, but this one, the language currently isn't too worrying to me, given that we've already got 12-year-olds being able to consent to mental health. And one key thing is, if you've already got a bill on or a law on the books, it's very hard to sort of change it completely. Like, we're not getting rid of the 12-year-olds being able to get mental health treatment. It's just how that bill is worded. Okay, next question. I followed the 7th grade situation for years, and now I'm wondering if anything has changed recently. I have an almost 7th grade son with a medical exemption, and his holistic MD says we'll need to start preparing his body to meet the requirements. Is anything different and or on the horizon for being able to continue his exemption? Unfortunately not. Unfortunately, it is going to be really, really hard to change the law here in California. We have tried every year. So December, January of the beginning of year, we shop bills. We take bills to the legislature and ask them for them to be authored. And one of the bills that we've been doing that consistently with is the religious exemption, to get a religious exemption back onto our books. And legislatures just don't want to pick it up. So I don't see anything changing, especially if you've got a child, let's say in 6th grade. I don't see anything changing rapidly or in time. As for the medical exemption, your medical exemption will no longer be valid. And so you do have to, when your children are getting to that level, or if your doctor has been put on probation or disciplined in any way, and your medical exemption is revoked, really your 3 options are to vaccinate, to homeschool, or to move out of state. Unless they have an IEP. If they have an IEP, which is an individualized education program, if they have that and they have special needs, then they are exempt from vaccines. Although, having said that, this year, some memo went out somewhere that is saying that everyone needs to put the vaccines into the immunization registry, and that the vaccines are required for those children with IEPs. Thankfully, the organization Educate Advocate, who is an amazing organization that helps parents, they are helping parents make sure that the children with IEPs stay in school and are allowed to do so without vaccines, or without full vaccines. Okay, next question. Christina, part 2. Should AB 659 get passed, do you have a sense of what the odds are that Newsom would veto it? Didn't he veto it last time under a different name? 2, if he did pass it, what other courses of action remain? So this is an interesting one, and I don't know where Governor Newsom sits on this issue. I think he may veto it if the number of children truly are, and we believe it's about, we know 30% aren't vaccinated. The question is, how many of those would go and get vaccinated if this bill passed? I think if it made it all the way through, as is, with no exemptions, that there is a good chance he vetoes it, because he wouldn't want that many children out of school. So this bill did not come forward. Having said that, Assemblymember Aguilar-Curry changed or amended the bill. So when it was introduced, it was just the HPV vaccine mandate. And she then amended it to add a bill that she had last year. Last year's bill was AB 2516. And that now has language in it. So AB 659 now has language in it that would require certain insurances to cover HPV vaccines and pap smears and that type of thing. That bill, the governor, it got all the way through the legislature, and the governor vetoed it because she included some insurances that already covered the HPV vaccine, and so it was duplicative. And so my guess is she'll amend it this year to make sure that it's very narrow, that section of the bill. That section of the bill, we don't have a problem with. You know, it is what it is. If you want insurance to cover a vaccine, fine, but it's not, you know, it's not part of the bill that we really care about. So I think if the bill was put in front of Newsom today, I think, yes, he probably would veto it. But as I said, we have a long process on this bill. And I think the bill will look different by the time it gets to the Senate, by the time it gets to Newsom's desk. I do think, you know, the question right now, we're pushing and pushing and pushing and really trying to put pressure on having the Assembly member take out the language that is HPV vaccine mandate related. We're still in that focus. If it starts moving and rolling, you know, we may pivot and ask for amendments in it. But right now, if we can get, I mean, one of the key things here is if we can get school boards, principals of private schools, For example, the California Private School Organization, that's a lobbying organization, the Parent Teacher Association. Like, if we can get big organizations to take a stand of opposition on this, then we can puts the pressure on the legislature to withdraw the bill, withdraw that section of the bill. That's what happened last year with SB 871 and a bunch of other bills. 871 was the COVID vaccine bill that Senator Pan had. That's what happened with those bills. There was just too much pressure from big organizations and a lot of organizations and a lot of school districts that he couldn't move forward with the bill. And so that's what we're doing right now. So one of the other really key things to do is, if you have a public school, if your children go to a public school, go talk to the superintendent, go talk to the board members. We want as many letters as possible being uploaded into the legislative portal of opposition, because if that opposition can come, if the pressure is there, it's very, there's a good chance that she will remove that section, but there has to be the pressure there. And then your next question is, if it does pass, what other course of actions remain? The lawsuit remains. Unfortunately, when SB 277 passed, that lawsuit, there were 4 lawsuits that did not go anywhere. And so it's really hard to get a lawsuit to go anywhere on the school vaccine mandate. The majority of them have lost. Now, that wasn't the case for the COVID vaccine, but those were different lawsuits. When the legislature passes something, that's when the lawsuits don't come to fruition or don't go anywhere. So really, your course of action is to homeschool. I mean, if you're in a grade where your child gets moved up to 8th grade and you have to get the vaccine, your options are to homeschool or to vaccinate or to move out of state, unless your child has an IEP again. Okay, next question. Christina, if my child has a grandfathered in medical exemption and our doctor is not on the disciplined list, you are very lucky and you're one of a kind, because I think most doctors who wrote medical exemptions have been witch hunted. But I'm going on with the question. And in the exemption, it named the vaccines exempted from it includes Gardasil instead of HPV. Would this still be valid exemption if the bill becomes law? Thank you for your stamina. So the answer is probably not. The way the bill is currently written, it applies that if you have a new medical exemption, that it has to go into the CARE-ME system. The list of the vaccines was required beforehand, and if you, in sort of foresight, put in the HPV vaccine there, and you put in Gardasil, it should be the diseases usually that are listed, but I think it would be one and the same. I think if an ME like that was accepted, I don't think the fact that it's Gardasil versus HPV makes a difference. I just don't think your ME is going to count if this passes and you needed an ME to get out of it. As I said, if your child is in 8th, 9th, 10th, 11th, or 12th grade right now, it is unlikely that you will, right now, the way it's written, you wouldn't need them to get vaccinated or have an ME. The answer is I don't really know, because we don't know how the bill is currently, or how the bill is going to progress, and they haven't gone through. It's usually up to the Department of Health, once the bill passes, to come up with what you're talking about, which is regulations, which is to show that the letter has to include this, it has to do this, it has to have been written. I mean, we also went through a period, so in 2020, it had to be written in 2020. So it may need to be that the HPV vaccine, the medical exemption, is written now, in which case it would have to go into the CARE-ME system. Okay, next question. Are your efforts to educate legislators over the last weeks on AB 659? What is your sense of the overall response? Do you sense any are responsive? So we've met with every office other than Assemblymember Wendy Carrillo's office, and Assemblymember Wendy Carrillo on the Health Committee, which is where this bill is going. Assemblymember Wendy Carrillo's office, she is a co-author on it. told us that they basically weren't interested in talking to us because we submitted our opposition letter and they didn't think there was any point in talking because she was or is a co-author on the bill. I personally would have liked to talk to her staff to voice our concerns and see if there was, anything that she could suggest in making it a better bill, because that's part of what co-authors do. So, but we've met with all of them. I would say, so I think there is concern over the number of children that would be put out by this bill. And to me, it's called the Cancer Prevention Act, but to me, it's really the School Prevention Act is what it's going to do. There is concern over the fact that there is active litigation currently. And those are probably our two main talking points. There's also concern that this is not a communicable disease, that this is a STI. And so, if I'm sitting in the classroom and I have the measles and the person sitting next to me is likely to get the measles. If I'm sitting here and I have HPV, there's no way the person next to me is going to be getting HPV from me sitting in the classroom. And so that is another talking point that some legislators, some staffers are see the difference between this vaccine and this disease versus things like MMR. I think so because it is early, so the hearing's going to be on the 21st of March, and because it's early in this bill's history, legislators and staffers aren't willing to kind of take a side. They kind of want to get a feel for what other people are feeling. I do think that it will make it past the Assembly Health Committee if it gets there. So if this bill is not stopped by massive pressure from school boards, from, organizations, all of that, prior to the hearing, usually what happens in the first hearing, especially because it's in the house of the author, is that they say, well, you've got some work to do on this bill. It definitely needs to have an opt-out, or it definitely needs to be changed to this, or we definitely need to work out what's going to happen to the kids who don't get vaccinated, those types of things. But usually it makes it out with the premise of, this is the first committee, you need to do work on it. And so unfortunately, do I agree with that process? No, I don't at all. I mean, our whole legislative system is so messed up and so in favor of the legislature getting that bill through, even if it is not a well-written bill, not a well thought out bill, even though it has massive unintended consequences, those types of things. But I would say that they are definitely listening and they hear our concerns. What happens after that? Who knows? I mean, I think the key is to keep the pressure on, and that's why we're doing so many things to really put pressure on the legislators to think about it and to recognize that they are making a decision here that impacts a lot of California school children. Okay. Next question. My friends are in many groups, but we are frustrated with what we are doing, writing letters, going to board of supervisor meetings, protesting, etc., but nothing seems effective. What can we do to really be effective and to stop or reverse some of these bills, or get our elected officials to take us seriously? What you're realizing is the reality of politics and how corrupt maybe not even the right word, but how frustrating it is. The key piece is you don't have money. I mean, that's really what it comes down to. That's why the CTA, the Teachers Association, the Medical Association, the prison guards, all of them have clout because they have money and they are doing this, they can walk in and, they can change an election. The same with some of the labor unions. So it is a very different place when you are a grassroots activist. And it's part of why a Voice for Choice advocacy, we started this 8 years ago, and we have never stopped. We have always been in the Capitol at least once every other week for 2 to 3 days. And we, even during COVID, we had Zoom meeting after Zoom meeting, and we just are always present. And I would say, where you can make a difference is when I think there are two pieces as an individual. One of them is getting personal relationships with your legislator, with their staffers, with your board of supervisor, with their staffers. And I say that so that when you show up on an issue that you're really concerned about, that they actually see you as somebody and respect you as somebody and as one of their constituents, and that you're not always the person that's the naysayer or the I want you to go against this. And so, my perspective is to come in and try and be their friend, help them with issues that they are passionate about. So, most of our legislators are passionate about something, whether it's education or the environment or homelessness or mental health. There's something that I'm sure you can resonate with them and that they are passionate about. And to take that and then really look at it, really try and get to know them, get to know their staff, so that when you show up as Christina in the room, even if you say nothing, they're like, oh, it's Christina. I know what she stands for. She was really helpful last week when, we needed help at the homeless shelter or something like that. Or she has kids that are super sweet and, they go to this school and, we've done something of that school. Those little connections are what make the difference. And so when I say to people, go to their town hall meetings, go to their coffee mornings, get to know them, introduce yourself. Don't introduce yourself with an agenda. Just introduce yourself and make friends with them. I'm not expecting you to be their best buddy, but make friends with them, make friends with their staff. Bring cookies, bring, donuts by their, I like something healthier than that, but, bring stuff, bring a bunch of flowers to their office and just drop it off and share your story before you go deep diving into, this is a bad bill, I need you to take action on this. So that's one piece of it. And then the other piece of it, I would say, is when we have a tipping point is when we make a difference. So part of it is, just having the mass numbers on an issue and on an issue that makes a difference. So when legislators are hearing from their constituents that something's going wrong, it's like, oh, wait a minute, we need to listen to this, because this isn't just the crazy anti-vaxxer or the crazy, EMF person or whatever it is. These are people, these are constituents that we need to listen to, and there's pressure. I mean, ultimately what that does is it changes the vote. If your elected officials aren't listening to you, the best thing is to try and get somebody elected in 2 to 4 years. So those are the things that I would do or try to do in building that up. Should you still be doing the writing letters and protesting? I personally don't think protesting really gets you very far unless you can create a media storm. So if you protest and you've got tons of media there, fabulous, then you're making a difference. You're pointing out, going to rallies, those types of things. I feel like they take a lot of time and effort. And when I'm a big one of time, money, effort. Where do you put your time, money, and effort? And we all have such limited resources of time, money, effort, to put into this, that where are you going to focus and make sure that you focus and you're making the biggest impact that you can in that amount of time. Hopefully that helped and that answered your question. Okay, next question. Please explain your reply to me this afternoon, Ari, whether AB 659 is or is not a decoy to hide the secret progress of AB 665 through the legislative process, because it also is a bad bill. This is what Jennifer Kennedy said Saturday night on the LA Hispanic Republic Club radio program on 870 AM about 869. So thousands of us listeners are wondering if that is the case. So every bill has its own thing, okay? And I never think that one bill is covering up for another bill, especially when it's a different legislator that's brought it forward. So last year, at the end of the year, Senator Wiener had both SB 866, which was the vaccine minor consent law, and a transgender bill. And I think he got to the end of the legislative process and he needed to choose one that the legislators were going to pass through. And he chose his transgender bill. I think there was a lot of pressure and a lot of controversy over both bills. So if it's the same legislature, then the answer is possibly yes. As for this other bill, AB 665, as I mentioned before, it is a and I haven't read it in full detail. I was actually just going to pull it up while we're on here. It allows, so minors 12 plus can already consent to mental health treatment and counseling on an outpatient basis without their parents' knowledge. Okay. This bill basically removes the requirement that that the minor must present a danger of serious, I'll read it. It says the minor must present a danger of serious physical or mental harm to themselves or to others, or to be an alleged victim of incest or child abuse in order to get those services. And so currently they have to have severe mental issues. Basically, they have to be harmful to themselves or harmful to others in order to get the treatment without parental consent. It also says that this bill requires the professional person treating or counseling the minor to consult with the minor before determining whether involvement of the minor's parents or guardians would be inappropriate. So basically it is even more taking the parent out of the picture. Personally, if a minor wanted mental health treatment today without their parents' consent, they can get it. They can get it even if they're not harmful to themselves. They can make it that they're harmful to themselves. They can say, I feel suicidal, I'm going to cut myself, and that would apply. So if a minor is really looking to get mental health from a professional without their parents knowing, they would do it. They could do it already. One of the things that we look at when we go into these minor consent laws is that there will be more likelihood of schools, especially public schools, that have health facilities associated with them, that children will be encouraged to go to those health facilities and to get help there without their parents' knowledge and without the parents knowing. Now, the one place with this bill that I could see is, the whole transgender issue, and that this would allow children to get mental health treatment with respect to transgender treatment without their parents' knowledge. I definitely don't think AB 659 is a cover-up for this. Let's put it that way. They're two bills. They're just two separate bills. I don't think us putting time on 659 takes away from this bill. And if this bill is something that, I think it's a bill that we currently have on our watch list to see what happens to it. I see the pros and the cons to this. Number one, I don't think there are that many minors that are taking advantage of these minor consent bills. Now, as I said, if there is a health facility next door that's associated with a school, could I see children being sort of funneled into that without their parents' knowledge? I do, but at the same time, somebody has to pay for it, and insurance needs to be involved, at which points parents get involved. So there's more nuances to that. But as I said, I don't think we're watching that bill. I don't think it's a cover-up for sure, or a decoy that 659 is a decoy. I think 659 is extremely real. Like, we have absolutely had conversations with the author's office that it is a real bill and she plans on putting it through. There's, she's not holding it, dangling it out there for us to look the other way. Okay, next question. And for those of you, I saw a few people joined in the last 15 minutes or so. If you have any questions, feel free to put them in the Q&A. Okay, next question. My sophomore has an IEP and so far has been cruising along without the 7th grade TDAP. The school district is now saying she needs it or will be kicked out of school. Can you speak to the IEP loophole exemption? So yes, this is something I mentioned this before. Schools are coming after IEP students. My recommendation is you go to Educate Advocates website, which is educateadvocateca.com, and they have resources on there. If you still are being hounded, I would recommend emailing them and they will absolutely be able to help you out. They're an amazing organization when it comes to special needs students and helping parents with that. And they have gone to court, to the special needs court. It's a different court. It's an administrative hearing court, and they have won on the issue of IEPs and not having to have vaccines for it. So they have standing on that. Next question. Do you have a sense of why this bill did not go to the Education Committee? AB 659 you're talking about. So this bill 100% should have been referred to the Education Committee. Again, this is political. So I will start off by saying, and I was educated about this last year, which, you know, longer. So I've been doing it for 7 years, and I was just like, it needs to go to committees. Committees in our Constitution don't exist. So they are something that the legislature has put in place for their convenience, so that bills don't just come to the floor and need a lot of work done on them. So the work gets done in the committees, and then they make it to the floor, which is in our legislative process, and they have to be voted on by the full assembly or the full Senate. So this bill, and I think the other piece of this is we got used to having bills referred to multiple committees. So if you go back to 2015, SB 277 was referred to the Education Committee, the Health Committee, and the Judiciary Committee in the Assembly, and to the Health Committee and the Education Committee in the Senate. And that was a lot of referrals. That was a lot of committee hearings. That's having something triple referred is now completely unheard of. Having something double referred is incredibly hard to get. This should have been referred to the Education Committee. It has more of an educational impact than a health impact, to be honest. It has to do with the code section that it changes, and that is the health code. So that our education vaccine requirements are in the health code, health and safety code, rather than in the education code. That's one argument. The other argument is, and this is completely political, is they do not want to deal with us one more time than they have to. So they don't want us up there twice. They don't want us there for the Education Committee and for the Health Committee. They would like to have us stay away for as long as possible, or see us as little as possible up there. And so I think that is one of the key pieces. And they also, you know, will cite, and you know, I think it's from a perspective of they don't want to deal with us, but it also does put a lot of strain on the hearings, the, you know, not the bailiffs, but the CHP officers, you know, they have to have a lot more security. They have to have a lot more people working the front where you go through the metal detector, those types of things. So, but, you know, to me, it should have gone to the Education Committee. The rules, the head of rules, who is Assembly Member Ramos, he is the one that decides basically where it's going. And then if the chair of the Education Committee, who is Assembly Member Marisucci, if he wanted to hear the bill in his committee, he could ask for it to be referred to his committee. But honestly, I think he's quite happy not having it referred to his committee. Like he's quite happy just not having anything to do with it and not having to deal with it in his committee. Not the way I think it's supposed to work, but the way it does. Next question. To clarify your response to the grandfathered exemption, are you saying that as it's written now, students who are beyond 8th grade with or without a medical exemption would not be required to take the HPV vaccine? So it would only be for incoming 8th graders, and students beyond would not need to get it. Yes, that's what I'm saying as it is written now, I believe. So it says it is required for entrance, not actually entrance, but for like going into 8th grade. And so if your child is in 9th grade, for example, or going into 9th grade, they have passed that checkpoint. They have passed that entrance into 8th grade. Now, there is a small piece of me that feels like CDPH could say, well, but they have already entered 8th grade. They've gone past 8th grade. They've entered 8th grade at some point. So we're going to apply it to the 9th graders and above. And the problem with that is if they do that, your child is out of school while a lawsuit is pending, if it is a lawsuit, if it's lawsuit worthy type of thing. And so your child isn't going to be in school anyway. So it's currently, is it written? Yes, that is what I am interpreting it, or it looks like it's saying. But if you have a 9th grader, I wouldn't be counting your blessings at this point. I think so much could change, and it's not 100% by any means. Okay, next question. When enrolled in kindergarten, we had a medical waiver notes. Now my kid is going into 7th grade. The school requires a new medical exemption. It's tough to ask doctors to issue a medical exemption from the CA state website. Is there any way to fight this with the school? No, unfortunately not. So if you have a child who is going into kindergarten or 7th grade or starting school for the first time, if you want a medical exemption, you have to go through the CareME system. That CareME system, a parent signs up on the CareME system. That piece of it is easy. You then go to your doctor and you say to your doctor, I'd like a medical exemption. Could you please fill out the information? They have to go in and fill out the information. I'll come back to that. And then submit it. And then you take the submitted piece to the school, and the school looks it up to verify it. Now, the problem with the medical exemption is, number one, no doctor is willing to fill it out, because every doctor that has been doing medical exemptions has been witch hunted and disciplined. So they are running scared. Number two, what we have found, even if there is a doctor who doesn't know any better and writes a medical exemption in the CareME system, it is automatically looked at by CDPH. They're looking at every medical exemption. And I would say most likely it gets revoked, and your doctor gets a letter back. You get a letter back saying it's been revoked. It's not, it doesn't apply, or it doesn't comply. And the problem with it is that most doctors are putting in medical exemptions for all vaccines, and it's permanent. And the problem with that is there is no way, according to the CDC contraindications, which are the guidelines of what medical exemptions get written on, that you can have a medical exemption for all vaccines for all lifetime. Because every vaccine, the contraindication mostly is you have to have had 1 dose. And if you had basically an anaphylactic reaction, you nearly died from it, then you're exempt from that vaccine and only that vaccine. And so you know, if you had a reaction to the MMR vaccine, it's fine for you to get all the other, 7 diseases vaccinated against the other 7 diseases. And so it is, and then the other piece of it is, for example, if your child had seizures, well, fine, you don't want to do it right now, but once their seizures are better, or they're not having as many seizures, or they're under control from medication, it's fine to go ahead and finish up that vaccine's, booster doses. So it's really, really hard to get a medical exemption. And doctors, if you even find a doctor, the only 2 places where I know of medical exemptions being accepted is, number one, if you have cancer, or somebody going through cancer chemotherapy, oncology in your family or the child, then the live vaccines are not recommended. And so they can get that. But again, that's temporary and just until the person has finished chemotherapy. And the second one is titers for the chickenpox. So if your child has had the chickenpox disease, then putting a medical exemption in for the chickenpox vaccine is being accepted. Okay, next question. Do you see any change in the environment in the legislature now that it seems more people have become aware that vaccines are not all safe and effective, especially after what people are seeing the COVID vaccines are doing to people? So the answer is yes. The conversation is much more open these days. So when we walked into the offices in 2015 and we said the word vaccine, the lights went off. They just stopped listening to us. Even in 2019 with SB 276, it was still very much vaccines was a bad word. You could say the same sentence with some other word in it, some other product or some other medical treatment, and they would be listening. And once you said vaccines, it was like, oh God, we're not talking about this. I don't want to have this conversation. It is definitely, COVID has definitely helped us in the fact that I think the biggest difference is that the COVID vaccine was given to adults. So with the childhood vaccines, either you got vaccinated when you were a child, and so that was, for most people a while ago, or and that was your most recent memory of vaccinations, or you had kids that you have had them vaccinated but you think that's safe and effective, and so they didn't really have their own personal experience. So with COVID being given to adults, they now had their own living experience, right? And so things like transmission, getting COVID after you had your vaccine and you did the right thing and you got your second booster and yet you still got COVID. Every one of those legislatures, I think, got vaccinated and got COVID, and staffers. And so, seeing that, oh, these aren't really as effective. The other piece is, I would say that the majority of people either had an adverse reaction, and I'm not saying a serious adverse reaction, but were out for the weekend and were just like down and didn't feel well and just felt like crap with the vaccines, or know of somebody or themselves that had a more serious vaccine reaction. And so I would say that the majority of people out there, not even just in our legislature, but the majority of people out there have had an experience where somebody was vaccinated that they know of that had a more severe reaction to the vaccine. And so that does help us. Now, does it help us talk about, there's still very much sort of this, okay, but that was the COVID vaccines. They're different from the childhood vaccines. The childhood vaccines have been around forever. They have been, they basically have, they're tested, they're safe, there's nothing wrong with them. So I think there is still, it's easier to talk about vaccines in general, but it's still not a slam dunk. Like, it's still, they still haven't necessarily completely changed their opinion on it. I do think there are legislators who have children who did not necessarily want to get the COVID vaccine for those children, that have realized that, yes, parents should probably have the choice, and they've translated that to the childhood vaccines as well. Especially, I think this is where, this HPV vaccine is really another one. And I'm almost, I don't want to say this, but I'm almost glad that that's the vaccine they chose, because it is an STI, because you can't catch it in the classroom. So it allows us to have that conversation more than, COVID was very transmissible in the classroom. And so it's a different conversation. And I think all conversations are good. Okay. How frequently are the school districts checking the list of doctors who have had disciplinary action against them because they wrote medical exemptions? So this is an interesting one, because I think there are some schools that check it a lot, and then there are other schools that don't check it at all. And then I believe maybe once a year, CDPH, I know a couple of years ago, they sent out the list of all the doctors that had ever been disciplined for anything, not for just medical exemptions, for anything. And they specifically, sent that out. I believe they updated it. They did actually. They updated it last year, because last year they updated it and they included accused physicians as well. So they hadn't been disciplined yet, but they had been accused. And so we actually wrote them a letter saying, you did this incorrectly. You shouldn't be the accused. If they're accused, they're not disciplined yet. And so they actually updated it. So my guess is that CDPH sends the list once a year. And so your school will look at that list once a year. And the majority of, I would say, private schools probably do it less frequently than public schools. And there are some public schools that are absolutely on top of it. And the minute your doctor gets disciplined, they are on top of it. And my guess is those schools are sort of signed up for the medical board license alerts, which I'm signed up for, which basically anytime anyone, any doctor has a public reprimand or disciplinary action, it gets sent out in that email. And my guess is they have somebody monitoring, and they know, the doctors who have written the medical exemptions in their school. And so they're checking it between that. Okay, next question. Can you speak to the lawsuit that settled in San Diego, USD? I can decide, and whether the ruling extends beyond the COVID vaccine mandates versus any vaccine mandate. Might this show any possibility for future legislation against vaccine mandates without an option of an exemption? Yeah, so it was actually Let Them Breathe that won the lawsuit. I can decide. They either had a similar suit or which joined, or they put in sort of an amicus brief or something. But the main group that was at the forefront of that lawsuit was Let Them Breathe. And so their lawsuit specifically was, and there were a number of these lawsuits across the state, was that San Diego Unified was putting forth that they had a requirement for the COVID vaccine. The way our law is written with respect to vaccines for school, it specifically says that the California Department of Public Health can add a vaccine, but they are the only ones that can add a vaccine. And so because it specifically says that they can add a vaccine, it means that no one else, individual schools, school districts, can't do it. It has to be the Department of Health, or it can go through the legislature. But those are the only two entities that can change our school vaccine laws. And so what the ruling was that San Diego USD could not themselves put in a vaccine mandate. So it doesn't apply to future vaccines. For example, it doesn't apply to the HPV vaccine because the HPV vaccine is going through the legislative process. So an example would be if a school decided, oh, well, we want to require the HPV vaccine for school tomorrow, they can't do that. So that lawsuit would hold in that case, but it doesn't hold if it's going through the legislative process or if the Department of Public Health adds the vaccine. Okay, next question. Are religious organizations, private schools responding so far? So we don't get the sort of insights of who's uploading legislative letters until it goes through the legislative analysis and we see the list, or we request it, but we usually can only get that a couple of days before the hearing. So we're not seeing who it is. We do have conversations with various groups and organizations, and for the most part, most of them are in the process. So for a school, not so much a religious organization, although, for example, the Catholic diocese, they have to go through a process. It's not like a religious organization usually can just say, oh, we're going to oppose this. They have to go to their board or, have a meeting about it, those types of things. Same thing with a private school. Usually a private school, the principal can write a letter. They may need to get their board members to sign off on it. So it may take a little bit longer. So that's why we're saying, if you have a school board or a principal or a superintendent or a religious leader or basically anybody who runs an organization that is willing to write a letter of opposition, to really go talk to them now and to ask them to write that letter of opposition ASAP. The letter of opposition does not have to be long. They have to upload it to the legislative portal, and they have to have it on a letterhead, and they have to give who they are and their title on it. But they don't have to write anything more than we oppose AB 659 and a short, 1 or 2 sentences of why. and they will be counted as a letter of opposition. So it doesn't need to be a long letter. Now, our organization wrote a 4-page letter because we wanted to make it absolutely clear as to why we're opposing it. But if it's just for the purpose of sort of adding a notch and being another organization, you don't need to write a lot. Okay. Christina, do you have any sense of whether the state legislature usually uses plans to remove waiver options in an amendment after passing an initial law? Thank you for taking the time to chat with us. I'm not sure what you mean here because we don't have, I'm assuming you mean the vaccine bill, and we don't have waiver options. So we don't have exemptions in California. They could add an exemption. So she could add a religious belief, a personal belief. 2 of the other states that have the HPV vaccine as a requirement for school actually just have an opt-out. So you don't have to have a reason. You just sign a piece of paper saying, I'm opting my child out of this policy. The legislature, so if a bill passes this year and it doesn't have an amendment in it that adds an exemption, then the law goes into effect and it would require a whole new bill to get the exemption added and it would take a whole year to get through. An amendment is specific to the bill as it's passing along the legislative process, and that can go in at any time. I hope I answered your question. I wasn't really sure. I'm not sure I covered it. If I didn't, then definitely put another question in and ask me. Do you know how difficult it is to get a medical exemption from all vaccines accepted by the University of California schools? I don't think they accept religious exemptions anymore. So the University of California only accepts religious exemptions for the COVID and the flu vaccine if they're requiring the flu vaccine, and if they're requiring the COVID vaccine, they're moving on. For the rest of their school vaccines or their childhood vaccines that they require, you do have to have a medical exemption. The difference between that medical exemption and the one used for California schools is that it can be written by a physician's assistant or a nurse practitioner, as well as a doctor or a doctor of osteopathy. It also can be written by a doctor that is outside of California. So it is easier to get a vaccine exemption written. I believe all of the ones that I know people have submitted to the University of California have been accepted. Okay, a general vaccination question. If my daughter has already passed the checkpoint of 7th grade regarding vaccines when she reaches 9th grade at a new school, will her vaccine record be checked again? This is assuming no new vax laws get put in place before then. So yes, most high schools require vaccinations, the vaccination card or your medical exemption, whatever it is, to be completed when you go into high school. The one exception for that is if, for example, you go to a K through 12th grade school or a 6th through 12th grade school, they'll look at it at 7th grade and not check it after that, because if you've passed 7th grade, you've passed 7th grade. But if you are going into a new school, yes, the school will check the vaccine records. Okay. Is Newsom still going to sign the bill for the COVID vaccine to be required as a shot for school come June 2023? No, word has it. So it wouldn't have been Newsom that would sign that. It would be CDPH, the California Department of Public Health, that would have put that order in play. They told EdSource and another press organization that will not happen in June 2023. We and a couple of other organizations have been pushing for CDPH to make a public announcement, official announcement that they will not be pursuing that. Currently, they have just told the press, and that's not good enough for us. So we keep pushing them to make some public statement, especially for so the state of emergency went away last week, and based on that, they put out a whole load of statements saying, this is no longer in effect, this is no longer in effect, and we really would like them to do the same thing with the COVID vaccine for schools. But they have come out and stated to the press that it will not go forward, and I don't think it will go forward. Next question, what amendments would you accept? So this question, I'm assuming this is AB 659. So right now, I wouldn't accept any amendments. because I still feel like we have, as I mentioned before, I still feel like we have the potential to have pressure from schools saying, no, don't do this. We cannot have this go into effect because it will affect our budget and it will affect our students. If we can put that pressure on and get the schools to pressure and say no, I truly believe, based on last year, that there is a chance that this section of this bill could be removed. And so right now, I'm not willing to have any amendments because I do believe we have the pressure for that. I think an amendment we could end up with is a religious or personal belief exemption or some form of opt-out that sort of takes it in a staggered process. I do think if that happens, Assemblymember Aguilar-Curry is in the legislature for another 4 years. Could by the end of the 4th year, we have another bill that removes the religious exemption or personal belief exemption? Yes. So, that's not a good enough reason for me or a good enough amendment. I would like to see if we can get rid of the bill. If we can't, then I do think there are amendments that could be made in the form of an exemption. And it would need to be a very general exemption to make it allowable. Okay, do you know any action being taken by anyone in the state to try to advocate for vaccine homoprophylaxis and this being a viable option to fulfill the requirements for public school? I understand that homoprophylaxis is accepted in some states and that there have been a couple of doctors in the state who've taken action on this in the past. So for those of you who are not familiar with homeoprophylaxis, it is basically a homeopathic remedy that acts like a vaccine and triggers the antibodies in your immune system, but using homeopathy instead of using vaccines. So I don't know of any states. If you do know of a state that accepts homeoprophylaxis, please do send it to me, because I don't think there is a state in the country that accepts homeoprophylaxis. Knowingly accepts it, I should say. Like, are there parents who get a vaccine card with homeoprophylaxis written on it? Yes, there are, but I don't think there's a state that actually says that homeoprophylaxis is a viable alternative to vaccination. I think my guess is those parents are signing a religious exemption or a personal belief exemption, maybe. The problem with this is our country doesn't believe in homeopathy. The FDA is doing everything they can to try and stop homeopathy. So I just think it's a dead end street when you look at if you're trying to ask the legislature to consider it because they think homeoprophylaxis and homeopathy, it's just you're a quack if you believe in that. So I think my perspective, maybe in Europe you'd be able to, and in England specifically, but here I just don't think I don't think it's a viable option because they don't believe in it. Sorry. Okay, I am new here too. A very basic question. If I have a medical exemption for my 6th grader, will that medical exemption be applicable and valid for 7th grade? It's my understanding that we would need a new medical exemption for 7th grade, and thereafter. It sounds nearly impossible. Thank you for taking this question. So I did answer this question. I would recommend you going and watching it again, but just very briefly, the answer is you need a new medical exemption. It has to go into the CareME system, and it is very impossible to get. Yes. Okay, next one. Now that the state of emergency has ended, are masks still necessary to be worn in medical offices? Since there are plenty, they are a private entity, are they still allowed to require the now proven ineffective masks? So the answer is no, there is no requirement. Although if you live in the city of San Francisco, their county public health officer just put in their own order that you do still need to wear masks, which is insane to me, but they put it in place. If it is a private entity, can they require you to wear a mask? They can, but in most instances, if you walk in without a mask on, they can't really force you to put one on, and it would be hard for them to enforce it, basically. So what I usually do, I will say there are some legislative offices that still have a big sign on the front, not many anymore, but the big sign on their door that says, please wear a mask if you're coming in. I'll walk in without one. If they say, please, can you put a mask on? I'll put a mask on, because clearly they're more afraid of me than I'm afraid of anyone else. But for the most part, nobody says anything, and it's as if the sign wasn't on the door. Okay, Christina, this is not a question, but thought it may be helpful to mention that the book Think Again by Adam Grant may be helpful for participants on this call. It teaches how to debate and help others reconsider their position. Ignore the chapter that is pro-vax, or learn from it and how it applies for our position. Absolutely. So I'm a big believer in the other thing that I recently had our group take a course on is NLP, neuro-linguistic programming. And not necessarily, I'm a big believer in, I read and I take in stuff from all places, stuff that I don't agree with. I mean, for this point, the chapter on pro-vax, I would read that to see how they're attacking things, how they're using things. But just understanding the mind and how people are, and how when you want to talk to somebody and get them to listen to you, attacking them isn't the way to go, right? It's when you attack somebody, they become defensive. When you attack their friends, they join up with their friends, even if they don't agree with what their friends are saying. You know, it's very much that if you want to try and talk to somebody and have them listen to you, you need to be empathetic. You need to listen to where they're at in their story and in their life, and how do you meet them at that place? How much do they know? How much do they want to know? How big is that seed you're going to plant? And are you going to water it today, or are you going to let someone else water it, or are you going to water it in a week or 2 weeks time? Those types of things. So thank you again for those people who want to know. The book is called Think Again by Adam Grant. Okay, maybe this is a dumb question, but why is she pushing this bill? Do these people not know of all the side effects of litigation, or did they just not care about this? So Assemblymember Agia is pushing this bill because she has had a personal experience of friends and family having cervical cancer, and she truly believes that if they had been vaccinated, that they would not have had to go through the cancer experience. And she truly believes that this vaccine will stop HPV cancers. She does not think that the side effects outweigh the risks and the detriment of cancer. You know, people live in their bubble. We live in our bubbles. You live in your bubble. I live in my bubble. And, you know, I'm probably less in a bubble because I read a lot of pro-vax stuff. I read stuff from all over to understand what's going on and how I formulate my arguments and how people are going to hear me. But realistically, you know, is she living in her bubble of fear of cervical cancer or other HPV cancers? 100% yes. She also, her county has the lowest HPV vaccination rate and the highest cancer rates. Now, those two things don't equate to one another, because the oldest person that could have gotten the HPV vaccine is now 30. They got it when they were 13. It's been out for 17 years. They're 30 years old. The average age of cervical cancer and other HPV cancers is 50. So the fact that, you know, people are getting cancer doesn't have anything to do with being the lowest vaccinated, because those people wouldn't have been vaccinated anyway. You know, I'm a believer of cancer is environmental. So my guess is it has to do with, you know, the area she lives in. It's also a rural area, you know, it has rural areas in it. So, you know, those people don't have as much access to healthcare, blah, 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 blah. There's a lot of reasons, but it really comes down to her desire to stop anyone having to go through a treatment for cervical cancer and dying from cervical cancer. So that is her motivation for it. Has the author stated why she feels the mandate portion of this bill is truly necessary? Is she concerned about the impact on ADA at all? So I think we were the first organization that brought that up to her. I think her perspective is, well, you know, most of those people will get vaccinated. I don't think that's the case. But I also, you know, it's our numbers against her numbers, or our argument against her argument. I think she feels the mandate is necessary because we are only at a 70%, and her county is lower vaccination rate. And this vaccine's been around for 17 years and the rate should be higher by now. And so why not get vaccinated? I mean, she said this in an article, in an interview with I think it was CBS in San Diego. She said, why not put this vaccine mandate in place if it increases the number of vaccinations for HPV and it stops people from getting cervical cancer? So that's where she's coming. Why not? She does not see the side effects. She does not see that there's any issue with it. I do think the ADA impact, I mean, that's, one of the pieces is if we can get the pressure on her from the other legislators on the health committee, as well as from schools and principals and blah, 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 to put this pressure on that she cannot do this. She cannot mandate this because the loss, both from a financial perspective, as well as from a mental health perspective, just can't happen. Okay, next question. Why do children with IEPs not have to get vaccinated? And a bill requiring all children to get vaccinated was passed. So a bill in the 1960s was where this started. And in the 1960s, it was passed that children had to get vaccinated for school. And it didn't include the hepatitis B vaccine or the chickenpox vaccine at that time. And it may not have included some of the others, but it definitely included polio, MMR, I want to say Tdap, I want to say pertussis and tetanus and diphtheria. And at that point, it had a personal belief exemption. So in 2015, the personal belief exemption was removed because it was felt that too many people were taking advantage of it and our vaccination rates were lowering. Now, just as a clarification, only 2.7% of children in 2014 had a personal belief exemption. So a tiny number, we're talking 30% now that are not vaccinated for HPV. So that's a huge number. So it was a tiny number. And in the progress of that bill, the special needs organizations basically, and even us said, you can't do this to special needs children. And the reason for that is that federal law trumps state law, and the federal idea, the Disability Act, trumps state law. And this Disability Act says that children have a right to a free and public education, but the least, it's not the least invasive, but the least restrictive environment. And so children who have special needs should be put in the least restrictive environment, that regardless of what your vaccination status is. So that trumps state law. And that's why we have that caveat in SB 277 when it passed. Are you aware of any resources for a parent who doesn't want to vaccinate in family court for a custody case when the other parent wants vaccination? My understanding is that the courts are pro-vax, so wondering if there are any help available to support health freedom for the child. The health freedom parent is the sole legal custody of a medical and education, by the way. Please have them get in touch with me. So I have gone through this personally, and I have helped it's probably over 100 now families, one side of the family, go through this. The key piece I would say is the age of the child. The older the child is, the better. If the health freedom parent has sole legal custody over medical and education already, then just darn well make sure that they don't lose that. Clearly something's gone on, because if they are in California, I don't know, you didn't say if they were in California or not, but if they are in California, California is very heavy on giving parents 50-50. So there's clearly been something that went on that gave that parent sole legal custody. So ensuring that that's the focus, not the vaccinations become the focus. But so often in these court cases, custody cases, the parents both agreed not to vaccinate while they were together, and then it becomes a contentious issue. And the person wanting vaccination knows that the courts will lean that way, and the courts will see the parent as the sort of evil parent if they're not vaccinating. The other question I would have is it for all vaccinations, or is it just the COVID vaccine? So the COVID vaccine actually changed the family court system a little, because it wasn't required for school. And so that is also different. So one of the things here in California that gets hard is if the parent doesn't want to vaccinate, it means that child can't go to school. They have to homeschool. And that's something that the courts also don't like. If your child's been homeschooled all their life, then that's fine. The court's just like, okay, keep doing what you're doing. But if your child has not been homeschooled, they really look poorly upon homeschooling a child, and they want the child to be in public school or private school. And if they're in public or private school, then they have to be vaccinated. And so that's where it becomes tricky. If you're in a different state, then it's different because you have a religious exemption or a personal belief exemption that you can use, so it becomes different. But absolutely have her contact me. I'm happy to talk to her. As I said, I've helped so many parents on this. It's not easy though. It really is not easy. And so it's strategy and tactic. And I have a couple of lawyers who have been working on this and fighting it and winning to some extent. It always comes down to the judge and what the judge's personal opinion on vaccines is, but there are ways to make it more likely to win. Okay, the next question. Why is CDPH able to override your doctor's medical exemption? It's a good question, because they have that authority. They have the ability to do that, and they are the ones that are checking the medical exemption that it complies with the CDC contraindications and precautions. And so that's really why they're overriding it, because the CDC states that these are the reasons you can't get vaccinated. If you don't fulfill those reasons, then you can still be vaccinated. And so that's what they're really checking for. I get that doctors, have their own opinion and should be able to give their own opinion, but it is not the way it works in our system for school, at least. Can we get exemptions from Mexico? Not for school in California, but for college you can, yes. What happens with students who will graduate next year and they don't have the HPV vaccine? Will they need to do remote class? When could this go into effect if passed? So if it could go into effect as early as January 2024. If you have, let's say, going into a senior year next year, my guess is they'll push it that you can finish the year without it. But if they didn't, the way it's currently written, a 12th grader wouldn't necessarily need to get it because they are not going into 8th grade. But if for some reason 12th graders were required to get it, then yes, they would have to do independent study or something like that. The other thing I'll say with this bill, and I'm trying to find so there are about 700,000 kids in California that have not been vaccinated for HPV. I believe that those kids have parents who have actively chosen, for the majority, have actually actively chosen not to get vaccinated. Because if you're in school, you got the Tdap vaccine for 7th grade, and at that vaccination appointment, you would have been offered the HPV vaccine as well. And I think that's why 70% are vaccinated. But I think there's 30% of parents who actually have chosen not to get vaccinated, or, a large proportion of that. And I would love to find a database or somehow, and, it's in the CARE database, I'm pretty sure. Actually, it's not, because we want the flip side, the reverse side of it. So the people who have the vaccinations are in the CARE database. But I would love to find more people that have vaccinated their children for everything else. They just have chosen not to do the HPV vaccine. And, I think there are close to 700,000 out there. And so if we could also, that would be another way of doing this. And I'm thinking of launching a petition to try and find those people, but we need to sort of know how to target them first, which is why we haven't done it yet. But, if we could find, even if we could get, 70,000 of them to sign a petition, that would be a huge number of people. There are people that just don't vaccinate, but there are a large number of children who, 95% of, or 97% of children, somewhere between 95 and 97, are vaccinated for the MMR with the MMR vaccine. And there's 30% of those that are not vaccinated for HPV. So trying to find that number or who those people are, where those people are in California, is something that sort of in the back of my mind. If anyone wants to help with that, let me know. You can email me and say that you want to work on that, and I'd be happy for the help. Okay, next question. Will private high schools be able to upload vaccine records into CARE? Yes, all high schools that have access to CARE, which they all do, can upload information. The one question I haven't gotten an answer to is, if you have your CARE information locked, so they can't download anything, if you can upload, if the schools can still upload to your file on CARE. And I don't know the answer to that, and CDPH has not responded to me. I'm not sure they maybe know the answer to that. maybe the problem. Okay, I'd appreciate hearing your thoughts on insect protein and fake meat. Personally, I don't think our gut was designed for these chemicals. So if you are not on our email list or our Substack blog or our blog on our website, goes through our email list. But we have staff writers. So we have about 10 writers that write one article a week. They're not each write one article a week, but we put out an article every week. And we had an article probably now 2-3 months ago on fake meat. And I think it's just disgusting, personally. I think there are some, crickets, for example, have been eaten by the Chinese for eons. I personally don't care for them. They're lovely and crunchy, but they're not what I would taste or want to eat. Fake meat, I think, is why would you put your body through that? The biggest piece of that is so much of it is genetically modified, so to speak, and has chemicals and that type of thing that to me, our bodies were made to eat real food. I have a business called Real Food Bay Area. We deliver real food. I would go as far as saying that the food in the grocery stores that's not organic, not grass-fed, not all of those things is also bad, for you. Does that mean I eat perfectly all the time? No, it doesn't. But I do think that in general, our food system, a large proportion of our food system is bad, and our body wasn't designed for all the chemicals that are in regular non-organic food. So but yeah, no, the whole fake meat, it's interesting because fake meat, like there was this surge 2-3 years ago, and it sort of died down, and I don't think the fake meat companies are really what's going on. I think the most disgusting thing, which I found out because of this article that was written for a Voice for Choice Advocacy, is that there is a company that is making salami out of celebrity stem cells. So you can get like Brad Pitt salami because it's made from his stem cells, which is just disgusting. But anyway, that's maybe there's somebody out there that wants to eat Brad Pitt stem cells, not me. This question says, did you find NLP to be useful? If yes, do you have any resources you can suggest? I did, and my team did. And it was interesting because they each took away something different, and I took away something different. The overall experience was the same. I come to things, as I said, very much from I guess I'm skeptical, not only skeptical, but I'm not skeptical in the sense that I reject stuff, but I come from it that you need to teach me something. And I think the biggest thing with NLP, which is neuro-linguistic programming, is what was interesting to me is a lot of especially Democrat legislators have been through the training, and once you know that, you can see it in them. So it's things like just body language. So if I'm talking to you and if I'm talking to you and you're using your arms a lot and you're all big and all of this stuff, that I'm going to respond in a similar way. I'm not going to stand there sort of crouched differently or folding my arms or something like that, because you want to be empathetic to the person, you want to meet them on their level. So things like that was helpful. I realized I've done a lot of training, coaching, that type of thing throughout my life, because as I said, I like to be bombarded with information, and then I pick the pieces of information that make sense to me, and that's what I use. And so I studied to be a hypnotherapist. At that point, I did neuro-linguistic programming. I did, tapping, things like that. So there's a lot of stuff, and that doesn't have to do with communication as much, but there's a lot of stuff that I have done. I've been in the corporate world. I've started my own businesses. I've listened to a lot of speakers. I've done parent coaching, positive discipline, like all, you name it, I've probably done it. And I take different pieces from it. So the NLP was very helpful in just thinking about how different people communicate and how they are communicating to you and how you're communicating to them. I did the main NLP training. I did an online class. My team went to an in-person class. And I told each of them, take it or do it, but take it or leave it as to how much you gain from it. Take what's important, because that's my aspect of life is, things get bombarded at you, and you just take what resonates with you. Okay, thank you so much. Can you please speak more to your personal journey with schooling and vaccines? I can. So I started my journey when my kids, so I should say, I started my journey when I was a child, but I didn't realize I was on my journey. I grew up in England, and the vaccines that we were given were much less in England, and I had all the diseases. So I had measles, I had mumps, I had whooping cough, I had scarlet fever, I had, you name it, I had it. And so I've never feared disease. Chickenpox, I had, all of those. I never feared disease. In England, homeopathy is seen as sort of an adjunct to Western medicine. And the Queen took homeopathy. And so that was, anything the Queen does is okay for everyone else. So I grew up, and I didn't realize this until probably I had my own kids, that my one of the first aid kits we had at home was a homeopathic first aid kit. And my mom would be like, oh, go get some arnica pills, some bump pills, go get the burn cream, go get, and they were all homeopathic. I didn't realize that part of my journey until much later on. And I sort of looked back and was like, oh, I actually grew up pretty holistic. I did get vaccinated for smallpox. I got vaccinated for tetanus and polio. Did not get vaccinated for like MMR, chickenpox, whooping cough, any of those things. I had all those diseases. The interesting thing when in 2015, when I started this activism journey, I asked my mom for my medical records to see what I'd been vaccinated for. And I also asked, she gave me my sister's too. And the interesting thing was my sister did not get rubella when she was a child. And so they gave her the rubella vaccine, which was available just as an individual vaccine at that time. They gave her the rubella vaccine at age 12. So when she was hitting puberty, because rubella, if you have it when you're pregnant, your fetus can be deformed. And so I thought that was sort of made sense. I was like, oh, okay, you get to 12 and you haven't had it, then give the vaccine so you get immunity towards it, and you don't have the opportunity. But if you had it as a child, they prefer you to get it as a child. That no longer happens in England, but I thought it was an interesting concept. Anyway, fast forward to me having children myself, and I didn't think anything of vaccines until I decided I wanted a natural birth, and I wanted to sort of put together my birth plan. And I pulled one off the internet, and you have to realize it's 18 years ago, where there was not much of an internet, and there certainly was not all the information and not all the books that everyone has written since then on the vaccine issue. And I was going through the birth plan, and it said, whether you're going to breastfeed or not, whether you're going to use cloth diapers or regular diapers, if you have a boy, whether you're going to circumcise or not. And one of the questions was the hepatitis B vaccine. And I've said this to somebody recently. I said, if it hadn't been the hepatitis B vaccine, if it's the MMR vaccine that's given at birth, I'm not sure I would have ever gone down this path. Because it was the hepatitis B vaccine, I was like, hang on, why is my 12-hour-old baby going to get the hepatitis B vaccine? I don't have hepatitis B. I know that because I've been tested for it as I was pregnant. And so why would I give this to my child? Like, you get hepatitis B from needles and sex. My 12-hour-old kid is not going to be having needles or sex. And so I went down that rabbit hole for just the hepatitis B vaccine. If you had asked me before that, would I vaccinate my children? The answer was absolutely yes. I didn't know any better about it. I went down the rabbit hole. There was one Yahoo vaccination group that I joined. Actually, there was two. There was one national one, and then there was one in the local Bay Area. And I joined those two, and I got Sherry Tenpenny's 3 DVDs. That was all that was out there. And I got Dr. Sears's book and one other book. I don't remember whose book it was. Oh, What Doctors Don't Tell You. And I read those. And then I was just like, wow, I don't think I want to give this vaccine to my child. So then it was like, so we talked to our doctor, and she said, okay, then at 1 month old, you have to give these vaccines. And I was just like, well, hang on a second. Now that I've done the research on this vaccine, I want to go down the rabbit hole on all these vaccines. And even then I thought, we'll give them at a later date. But as I did more and more research, I realized that this was not something that I wanted to do to my children, and that I truly believe the risk of adverse reactions from the vaccine outweighed the risk of them getting the disease and getting really sick and or dying from the disease. Fast forward to when my children were 5 and 8, and I went through a divorce, and my ex decided that our agreement to not vaccinate our children was no longer in effect. And I filed, so when SB 277 passed, I'd already gotten a medical exemption for my children before, like in February of that year. And so when my oldest daughter went into 7th grade, I filed the medical exemption with the school, without my ex knowing. Well, my ex found out when I filed it, and we went to court on it. And my ex actually won medical decision making for the vaccinations for my 2 children. Thankfully, they are old enough that they have chosen not to get vaccinated, and so they are not vaccinated. And so that kind of gives you some background. I did get, then in 277 in 2015, I got into this fight. I never thought I would be an activist or do anything like this, but I fell into it, and I actually really, really enjoy going to the Capitol and educating legislators and having conversations with them, understanding where they're coming from, and sort of trying to find a middle ground. Like, I really enjoy doing that, which is why I've been doing it for 8 years, and I'm just super passionate about it. Okay, if the author's intent is to reduce cervical cancer, what about boys? How is she justifying this? Oh, so HPV cancers, it's really reducing HPV cancers. She had the experience with her family member, her friend, the personal experience with, I believe, cervical cancer, but she is talking about all cancers related to HPV. So that includes penile cancer, oral throat cancer from oral sex, and anal cancer. So that's the justification of boys. That's the justification of boys for getting the HPV vaccine. Okay. Is there still a vaccine working group in the state legislature? What is Richard Pan up to now? Is he consulting with that group? So they never disbanded the vaccine working group, but by the sounds of things, they are not active. My perspective on the vaccine working group, which was created last year at the beginning of the year, was that Senator Pan was wanting to put it together to get a legacy, his legacy, and make sure that his work continued. Most of the legislators that were in it, they all had one bill last year. Many of them didn't go anywhere. And they are not interested in bringing vaccine legislation forward. And so I don't think it will go anywhere. Senator Pan, I believe, is doing some consulting for the AMA, American Medical Association. He is also working with his nonprofit that he had started a few years ago, called Protect Us Now, which is a pro-vaccine group. I think they say they're advocating for the pro-vaccine majority. And then I have seen him in the Capitol. He's definitely talking to legislators. Now, he's not allowed to lobby himself for 12 months in the legislature, but if he has a contract lobbyist with him, then he can go to meetings and he can have conversations. So I saw him there probably a month ago when we were there. He ran into the elevator in front of me. I didn't get in the elevator. Oh, it was a different elevator from me, but it was, yes, I was not expecting him to see him there that quickly after he'd left, but he was there. So he's clearly having conversations. Okay. Does what you said earlier about the UC Vax requirements apply to CSU also? Yes, it does. They have the same policies, basically. 700 times approximately 13,000 is 9.1 billion in ADA loss. If they don't get vaccinated. Yes, it's a huge number in loss, and schools have already lost too much money in the last 3 years that they don't want to lose more, which is why we're really hoping that these schools recognize that if they lose 30%, even if they lose 20%, even if they lose 10% of their current enrollment, it's a huge loss. This is our argument. Find out how many LAUSD kids have not been vaccinated for the HPV vax and make the argument of potential ADA loss. We could include the largest school districts and some medium ones as well. Yeah, I mean, where I point to is last year with the COVID vaccine, LAUSD tried to implement a COVID vaccine mandate, and they had 30,000 kids, which isn't a lot of kids. I think their district or their school district is maybe 1 million kids. So 30,000 out of 1 million isn't, don't quote me on the million number. I know the 30,000 number isn't a huge amount, but they could not put those, they didn't have the placement for those 30,000 kids to go into independent study or to homeschool, to do online homeschooling. And so it fell apart, and they removed their COVID vaccine requirement because they just couldn't support those kids. And so I just, I think the number of kids that didn't have the COVID vaccine is probably equal to, or maybe a little greater, but equal to that of the HPV vaccine. And so I do think there is a huge, impact. And it's why we're trying to get school districts and superintendents and private schools to really speak out that they can't take these losses. And also our children can't take this loss. Being home for schooling was not a good situation for the large majority of children. Okay, next question. In response to finding those who decided not to vaccinate against HPV, I would be willing to guess it's because it has not been a requirement. I do still think that there are many families out there that will do the bare minimum for school. That number might be around 70%. I agree with you. I do think, the HPV vaccine is one of the most controversial, and it got, when it came out, it got pressed for being a new vaccine and questioned, and the litigation also has been in the news. So I think there's more to it than it's just hasn't been a requirement. There are other vaccines that are childhood vaccines that are not requirements for school that get decently high uptake. If we look at our records, our care records, is there a way to get confirmation that they're actually locked? So you need to submit. So this person's asking about your care, which is the California Immunization Registry. You can lock your records so that the schools and others cannot access them. It never deletes your records, but you can lock them so some can't access them. The system that they have, you have to fill out a form and you click submit, and you hear nothing more from them. If you want to know if your records actually got locked, there is an email address at the bottom of that form. And my recommendation is you email them, and you need to give them a week or two, but I would email them and say, could you please let me know that my records are actually locked? Because there is I wish they would add something to the system that, you click on the button and it sends you an email and says, we'll respond and let you know when they're locked, and then send you an email saying, yes, your records are locked, or they're not locked, or you didn't have any records, whatever the answer is. But that doesn't happen. You do need to email them. But I do know that people who have emailed them have gotten a response too. Okay. Can you recommend any type of detox for kids that have already been vaxxed? So there are a number of detox protocols. It really depends on what vaccine your child was given and how many, and the key there is, did they include aluminum? What were the ingredients with them? The key there, I think Russell Blaylock has a vaccine protocol. If you Google vaccine detox protocol, they come up. Russell Blaylock is the one that I know best, and that I would recommend as a starting point. But I would, if it were me, I would go into different I would look at different protocols. There are also naturopaths and homeopaths that have protocols set up that you work with them specifically and they can do analysis like hair analysis or blood analysis to see your levels of heavy metals, those types of things, and what needs to be detoxed. The one thing with detox that you just have to, in general, that you have to be careful with, and I'm not a doctor, I'm not a lawyer, I'm not, but just from not me personal experience, but from experience, is that if you're doing a detox, make sure you do it slowly, and especially with kids, because your body will start dumping, and that detox can almost be more dysregulating and impactful if you do it, if it's done too quickly and too severely. I personally would use a naturopath or a homeopath, or somebody who has experience in detox protocols, and have them help me follow what is necessary. Okay. Okay. If a child is not vaccinated, is there a care record for them showing that they aren't vaccinated, or are care records created only when a child is vaccinated? Does the COVID vaccine create a care record? Thank you so much for your help. So many different questions there. Your child could have a care record, because if they have a birth certificate and had a hospital birth, they more than likely put a placeholder in the care record. They may or may not have done, and it depends on how old your child is. So if your child was born today, most likely, if they were born in a hospital, they would have a care record based on that information, but it would show nothing. If your child didn't have that, then it would just be generated when you get vaccinated. It's also if they have a TB test. So the TB test is also input into the care record. So if you or your child has had a TB test for school or for employment, then it would be in the care record. The COVID vaccine 100% created a care record if you got the COVID vaccine in California. The reason behind that, and the reason I know that, is that the government was not allowing people to, or not allowing doctors or the big sites to get more vaccines unless they had shown that they had recorded all the vaccines in the care database. So the COVID vaccine in California 100% did. There was a question of what are common ingredients in vaccinations? What if somebody is allergic to an ingredient in vaccination? So the ingredients of vaccinations, the majority of ingredients, the main ingredients, if you search for online, if you search for pink book vaccine excipient, it will come up with the CDC list of all the vaccines and what their main ingredients are. Now, what is not included in there is ingredients in the vaccine that are what's called GRAS, GRAS, which is generally regarded as safe. So things like oils, if it contains sunflower oil or peanut oil or whatever, those are not included in the ingredient list because they're generally regarded as safe. So that's the ingredient list. And if you have an allergy, a proven allergy to a vaccine ingredient, that is a reason not to get vaccinated, or that is a reason to get a medical exemption. It is hard, though, to be able to prove that you have an allergy to a component of every vaccine, because the majority of those components are chemicals, and there just aren't the allergy tests for them. What happens when a doctor is on probation for a couple of years? This has to do with the medical exemption for school. Can they still practice? What if a license expires before probation is over? Are they allowed to renew while on probation? So this has to do with disciplinary action of doctors. There are different levels of disciplinary action. They can have a public reprimand, which basically means that a letter gets written saying, it's basically a slap on the wrist. You did something wrong, don't do it again. Or this doctor did something wrong, they've said they won't do it again. The next level is probation. So if they're put on probation, they usually put on probation for 3 years or 5 years. And during that time, they may also have to do some form of courses like continuing education. They may have to have another doctor oversee a certain percentage of their records if they didn't do good record keeping, those types of things. Once they're put on probation for 3 years, they can still practice during those 3 years. They can do everything the same. They cannot write medical exemptions, though, because of the law, but that's very specific. They may also be put on probation and be told, you cannot oversee any staff. You can't have nurses, assistants, underneath you. You can't be in the room alone. You can't, many of the disciplinary actions are for sexual misconduct. So those types of things apply. You can't use certain, I'm thinking of an alternative doctor that used ozone and misused ozone. And so they weren't allowed to use ozone. They weren't allowed to prescribe opioids, those types of things. So those are the things that go with probation. Usually probation, as I said, is 3 years or 5 years. Once they come off probation, they're back to having a regular license, but they can practice during that time, but with some restrictions, most likely. And then the last one is if their license is revoked. Licenses very rarely get revoked. What I have found with our doctors who wrote medical exemptions, the harder the doctor fights the medical board, the more likely they are to get their medical license revoked. So basically, if you don't fight the medical board, you're more likely to get a public reprimand. If you fight the medical board, you're more likely to get your license revoked. Okay. One other question on here is, what ingredients, allergens, chemicals are typically administered to the skin for allergy tests? What should we know? So the standard allergy testing, which is usually done on people's backs, they basically poke your skin many times with different allergies. I wouldn't do that, because my understanding is there's some chemical in that allergy test. When they poke whatever allergen it is, they poke something else in there. And from my research, and I did this many years ago, so if there's probably also new stuff that's happened in the last 5-10 years, which was when I last researched this. But I remember researching and being like, okay, I don't want to do that type of allergy testing. I actually, if you want to do allergy testing, I would recommend, and I'm not a doctor, but this is my personal recommendation, is to do this thing called Zyto testing. Basically scans your hand, and this is woo-woo out there, but it's actually FDA approved. It's an FDA approved device. So the FDA approved this. They haven't approved homeopathic medicines. But basically you put your hand on it, and it puts in different frequencies against your hand and sees how you respond. And it basically, because everything in the world has a different frequency, it can look at what you are what you're allergic to. And I didn't believe it, but I was probably 3 years after I moved to California, I had the worst allergies from pollen that I had ever had. I'd never had allergies before that. I got to California, and there was just one spring where I just could not, runny nose, runny eyes, and it was a mess. And I was not one to take over-the-counter medications. And so I went, and I was just like, all right, it can't hurt, let me try this. And within 24 hours, probably 80% of my symptoms had just gone away. So I like that. It's what I still use for much of my naturopath uses it. So it's what I use for much of when I'm sick or got something going on, but that's just my personal preference. And then the last question on here is, what are collagen supplements, and are they safe? What are they made of? Okay, so I'm not a doctor, but collagen is usually made from beef bone, some part of the bone, and it's basically a supplement. So the collagen is also in the collagen supplements made from that. Collagen is like the stuff that's in between your bones. And so when you take collagen supplements, your collagen levels as you age get less. And so you take them to keep your skin elastic, keep your joints going, that type of thing. But as I said, I'm not a doctor. So I don't know. I don't know exactly all the ins and outs of collagen. Okay. 2 more questions on here, and then I think we'll get done. I came in late, and I would like to know the status regarding college vaccine mandates and how I can get an exemption. My son has an exemption from middle school for the regular boosters. So a religious exemption you can get from most colleges except religious exemptions. There are a few that don't, but the majority do. If you go to our website, voiceforchoiceadvocacy.org, there's a tab that is called Empower Yourself. And in there is a religious exemption workshop that you can click on. And it's an hour and a half long, and I do it. And everybody who's taken it has gotten their religious exemption, or most people have gotten their religious exemption approved, especially for colleges and stuff like that. In the midst of COVID, we had a lot of people who were not getting any accommodations. So they basically were saying, yep, we approved your religious exemption, but we don't have a job for you because you have to be vaccinated to do the job. And then the last question is, how do we lock a care record? So that also, if you go to a voiceforchoiceadvocacy.org, drop down on the Empower Yourself, there is a care record locking tab that you can click on. Oops, there are more questions that showed up. Nope, just thank yous. Lots of thank yous. And then there's one more. Oh, somebody had a comment on collagen. There are supplements that don't contain bovine that are plant-based, which help your body generate your own collagen support, a natural process in creating collagen. Wonderful. I did not know that. I will keep going on these. Most of them are just thank yous, but I'll answer this one last question and then one comment somebody made. Thank you for thank you. How have you navigated with your children any feelings of being other because of not being vaccinated? In reality, for my family, becomes homeschooling, explaining to my young son why he might not be going to school with his other friends feels a bit daunting. So it's a conversation that I've had with my children since they were very young. And it doesn't just revolve around vaccines. It revolves around healthy eating and non-toxics. And the reason why my children aren't vaccinated is because they contain toxic ingredients, and we don't choose to put toxic ingredients in our bodies. We try and keep that to a minimum. And so that conversation has happened since they were very, very young. And I think they always, we didn't have a lot of candy in our household, things like that, that they knew they always knew they were slightly different. But then again, they knew they were slightly different because I have an English accent and because of, because of many, many reasons in my life. I'm not normal. And I don't bring my children up, sort of normal or I don't know what, but so I think it's a conversation, but it's a conversation we have, and I think they respect that that's where I was coming from. So I think that's that piece of it. Okay, the one other comment that a couple of people have said here and was also in the chat privately to me is, thank you so much, but also how can we support you? So we are a very, very small nonprofit. We have 4 people that work for us full-time. They do get paid fairly because I believe in that. I don't get paid at all for all the hours of work that I do because I'm passionate about this. But if you do appreciate what we're doing, my request is please do give a donation to A Voice for Choice Advocacy. You can go to avoiceforchoiceadvocacy.org/donate or hit the donate button. If you don't want to give through PayPal, we have Zelle, which is a bank transfer. That's info@avoiceforchoiceadvocacy.org is the email address you need. We have Venmo, which is at A Voice for Choice, and we have PayPal, Venmos. Oh, and you can send a check. So if you would like to give, any contribution, large or small, is much appreciated. I'm going to stop. All right. Thank you so much, everyone. I appreciate all of you, and I do this because of you. So take care and have a good night. Thank you. Bye-bye.